Good afternoon, everyone. We have reached our 12 o'clock hour on a Friday, and I'm delighted to welcome you all to our webinar today. My name is Nicole Payonk. I'm with the Pennsylvania Coalition for Oral Health, and today we are going to be talking about meeting workforce challenges with DANB, the Dental Assisting Professional Model. Before we begin, just a few housekeeping notes. This webinar is being recorded and it will be shared with our registrants after today's event, along with our slides from our presenters. So I want to start with our agenda. It's going to be structured to explore innovative strategies to strengthen dental assisting as part of our work to combat the critical challenges plaguing our oral health infrastructure in Pennsylvania. We will have some time at the end for discussion with our presenters, so please feel free to use that Q&A feature at the bottom of your screen, as we do not want any of your questions to get lost in the chat. So let's get started. And before we get into our content, I always want to take time to ground our intentions as well as recognize the work that each of you are doing every day. Whether you are part of the dental workforce as a provider or as a stakeholder supporting access to care, your perspective and your contribution matters in advancing the priorities of our Pennsylvania Oral Health Plan, which is the guide to the work that we do every day. Additionally, if you've been on one of our workforce webinars in the past, or if this is the first time that you're joining us, I want to pause for a moment and take a look at this map. It may be something that you've seen or explored before, but when we look at data like this, our instinct is to reach for a big sweeping solution aimed at fixing the entire dental profession as a whole. But our workforce isn't monolithic. We have dentists, hygienists, assistants, and our expanded function providers facing different barriers, different incentives, and different opportunities. So when we're looking at data and we're looking at providers, these distinctions matter, especially because when we put those two pieces together, only half of our residents, or actually less than half, I'm sorry, are actually having their dental access care needs met. And a stat that unfortunately hasn't changed really for the better is that we still need roughly 3 times as many dental providers to close our access care gaps compared to our primary care and mental health counterparts. So when we're looking at a problem of that scale, it's very clear that we are not going to find a one-size-fits-all solution to solving that problem. So today we're just going to take one little segment of where we can find some impact and explore opportunities, and that's looking at dental assisting as part of that dental workforce ecosystem. And I am so excited to have 2 speakers here today with us. And our speakers are going to explore not just the state level perspective of dental assisting in Pennsylvania, but we're also going to have an opportunity to learn more about national views on dental assisting, trends, challenges, and opportunities. So Paulette Dietz will be starting us off with our statewide perspective, followed by Hannah Aronovich from the Dental Assisting National Board, who will be providing that national level view. So I want to turn it over to our speakers. I'm very excited to get started. Paulette, take it away.
Thank you, Nicole. I appreciate the great introduction and all of the work that PCOH is doing. Being a part of consulting for the workforce initiatives and being a part of the team has been truly an honor, and I'm super excited to be here today. Like Nicole said, I'm really going to kind of dive deep into our current status of dental assistance as well as expanded for EFTAs in the state of Pennsylvania, and then I'll pass the torch along to Hannah. So just to kind of look at Pennsylvania as a whole, we're going to start as dental assistants first. Dental assistants are not licensed in our state currently. This means someone can work as a dental assistant without any formal credentialing process as long as they're supervised by a dentist. Their responsibilities are limited to different tasks that only dentists can legally delegate and that don't fall under the scope of other licensed professionals. So it's kind of a gray area when you look at the overall scope, but it is very limited. Some traditional duties, these would be things included like chairside assisting. We might even see these as sterilization techs or, infection control purposes, room setup, administrative tasks, and so forth. While the state doesn't require certification in these areas, some employees or employers may want those optional credentialing, like the radiology certification, and if they want those assistants to take x-rays or, complete other chairside exams as well. This role is often a starting point for a lot of dental professionals at an entry level. Nicole, whenever you're ready. Thank you. And then kind of switching gears, looking at expanded functions, dental assistants or EFTAs in PA. Unlike dental assistants, EFTAs are state certified in Pennsylvania. To practice, they have to complete a board approved education program, pass a state exam, and then also maintain continuing education requirements while holding a license. They do have an expanded scope that allows them to directly support restorative care, and this includes things like coronal polishing, placing and condensing amalgams, composite restorations, fluoride treatments, and sealants. Because of the workforce shortages throughout PA and increasing the demand for these restorative services are almost essential to kind of what Nicole was just touching on briefly there. Programs across the state have significant growth as the dental practices are relying more on EFTAs, and that's really to improve the efficiency and patient access to care. Next slide. Looking at some training and credentialing, the kind of landscape for EFTAs in Pennsylvania are offered through different varieties. Pathways include things like community colleges, technical schools, even private institutions. They are structured to prepare students specifically for those restorative dental procedures, and our curriculum are typically looking at three different components: our didactic instruction to build that foundational knowledge, laboratory practice to develop and kind of start that skill set with hands-on, and then they'll go out into private practices or practices across the state with supervised clinicians where they can apply those skills in a patient care setting. And this is, again, really heavily focused in restorative dentistry, working efficiently as part of a whole team. They'll then go on to complete their board-approved EFTA, or once they complete that board-approved EFTA program, they have to pass the EFTA examination, which is administered through Pearson VUE. Once they pass that exam, they can apply for licensures through Pennsylvania State Board of Dentistry. They are just like every other licensed or certified dental professional. They do have to maintain those credentialings and, like I said, maintain CE requirements to keep up with current clinical standards, materials, and obviously best practices as well. Thanks, Nicole. And then just kind of looking at our workforce numbers and trends throughout Pennsylvania, our most recent data from 2022 has shown that there's about 10,700 dental assistants that are employed statewide. And this has a projected growth of 3% over 2032. That equates to about 1,500 job openings each year. And unfortunately, a lot of times these are replacement opportunities or replacement positions. We did see a significant loss during 2019 to 2020, most likely, as all of us know, is due to COVID, and around 15% of the workforce kind of plummeted. That's only 20% hold an EFTA certification throughout the state of Pennsylvania that we can track through surveys and those licensures, but that doesn't mean that they're all practicing. A lot of our dental assistants are working below their potential scope to practice as well. So these kind of show or underscore both of our workforce fragility as well as untapped potential from other assistants. It's hard to actually get a metric number as how many assistants are throughout our state because dental assistants don't need to be certified. We can only do so through survey or looking at possible job openings and placements throughout. Thank you. So just that overall workforce picture. So again, dental assistants are at large. They're unlicensed in the state of Pennsylvania with different trainings, some certifications, some have associate degrees, bachelor's degrees. They are in demand, but often underutilized due to that limited scope, where on the other hand, our EFTAs are more regulated. They're in-demand providers as well, who are really expanding our practice restorative capacity. Thank you. There were some surveys also conducted by PCOH and DANB, which I'm sure Hannah will touch on as well from the Dental Assisting National Board side. But compensation remains a very big major factor in our workforce. The national dental assisting wage average in Pennsylvania is about $22 to $23 an hour, which is around $47,000 annually. Nationally, nearly 40% of dental practices are actively recruiting assistants, with many calling hiring a very big challenge or barrier and not having many applicants. Job satisfaction surveys, on the other hand, it's what PCOH looked at in 2022, shows that dental assistants feel underutilized and are desiring and wanting more responsibility and growth opportunities, which is in hope to enhance pay and scope of practice, which can directly impact our retention and morale throughout offices and through dental assisting as a whole. So just to kind of wrap up Pennsylvania's side of our workforce, dental assisting is at a crossroad. Recruitment, retention, geographic disparities present a lot of real challenges, but they are solvable, like Nicole said, but we kind of have to chip away at it together. The good news is there's already a lot of models in work, which we're going to hear about one of the most up and coming from Hannah, which I can't wait to see. And then the next steps that as stakeholders, we can implement collaboration, we can pilot, we can also keep track of data, but together we can build a stronger and more equitable workforce for oral health.
Thank you, Paulette. That was wonderful and really giving us a good lay of the land. And I'm equally excited to welcome our next speaker, Hannah Aronovich. As I mentioned, she is from the Dental Assisting National Board, and she is going to be talking to us about DANB and the Dental Assisting Professional Model. So thank you, Hannah.
Yeah, thank you so much for having me. Next slide, please. It was really interesting to hear the first part of this session because as I go through my slides, you're going to see a lot of connections. The same narrative pulls through here, which is always good. When we're all seeing the same things kind of happening, you know there's something to it. So today I'll go through a few topics, definitely covering the workforce issues and the dental assisting professional model, which was recently published. I'll share some examples of career ladders and how credentials and certifications can be used to build them and support clinics, across the state. And then I'll finish up with some insights on our research and get into a little bit more on expanded functions dental assistant utilization. Next slide. So the dental assisting professional model was really developed to address this issue of the shortage of qualified dental assistants. And this issue has been going on for many years. And two of the biggest challenges that arise from a workforce shortage like this are lack of access. I'm sure, some of your clinics may have felt it where not enough of dental assistants or other members of the dental team just makes it harder to see as many patients. And then when patients struggle to get an appointment, they may end up putting off their care or never even going, which we know can lead to worse oral health. There's also the safety risk. So with fewer qualified dental assistants to hire, practices and clinics might turn to on-the-job training, which is a great way to quickly onboard a new dental assistant. But then what happens is each dentist trains their assistant a little bit differently. And oftentimes it's another dental assistant currently working at the clinic who then trains the new dental assistant. And so I sometimes refer to this as pass it on training, where you've got this like game of telephone happening with the training and no standardization between one dental assistant who's been trained on the job and another. So when you have that discrepancy in training, it just makes it more likely that there could be an issue with infection control or a breach even to providers, for example, with radiation exposure. Dental assistants are the ones taking x-rays again and again, day after day. So there's that provider risk as well. Next slide. So what exactly is the dental assisting professional model? It's a document that includes proposed levels for dental assistants with affiliated descriptions of those levels, as well as proposed functions and education and credential recommendations for each level. Next slide. And so the idea for even developing a model like this really came from the dental community. A few years ago, DANB conducted 2 different sessions to gather feedback from leaders across dentistry. And overwhelmingly, this came up again and again, that there was this need for more uniformity across the country for the dental assisting profession. And a great example is the expanded functions dental assistant. So Ohio also has an EFTA level. And if a dental assistant who's an EFTA in Ohio decides to move to Pennsylvania, which also has an EFTA level, they can't just start working as an EFTA in Pennsylvania. Depending on how they met the requirements in Ohio, that Ohio EFTA in Pennsylvania may need to start entirely over with their education and retaking exams. And so that really impacts the workforce. It impacts not only how quickly can someone who moves to Pennsylvania begin working as a dental assistant or an EFTA, but it could impact whether they stay in dental assisting. You know, that person might decide that it's not worth it to go back to school and retake exams. And so they may take a different job and potentially leave dentistry entirely. So there are a lot of impacts and consequences that can happen due to this lack of uniformity across the country. Next slide. So to address this issue, we brought together another group. Even though, you know, DANB was the one that kind of convened and supported this initiative, it really was driven by this work group. And so there were 20 individuals who came from 10 different dental organizations, and there was representation from people across the country and in many different roles. So we had dental assistants, educators, hygienists, dentists, regulators, and a member of the public all serve on this work group to develop the model. Next slide. And since the model was published, we've been so humbled and pleased to see so many organizations providing their support, including the Pennsylvania Coalition for Oral Health. We truly thank you and all the organizations that express their support for a model like this. Next slide. So what the model does is it outlines 3 levels for dental assistants, and it's designed to be both flexible and practical. So it does create multiple pathways into the profession, including a pathway for on-the-job training, which we know is a reality in an important way many enter the profession, but it also recognizes attending a formal or an accredited dental assisting program to lead to advanced standing. And one of the most important things that it does is it builds on existing similarities across the states. So it's not looking to put forward entirely new ideas or, you know, revolutionize what dental assisting looks like. It's really designed to build on the commonalities of what already exists. Next slide. And so a model like this, you know, we recognize that it's something that, you know, is not, change doesn't happen overnight. But if states do start adopting this or coming closer and closer together to be more uniform, it really will address the workforce issues and create a larger workforce of qualified dental assistants. And it also creates that career path for dental assistants to encourage them to stay in the profession and grow. And through that, ultimately, patients will be able to get the quality care that they need. Next slide. So there are 2 really key use cases for a model like this. The one that I touched on, which is regulators, state dental boards that might be looking either to create a new level for dental assistants or refine or revise their existing levels and scope of practice. So, for example, a state could decide that it wants to look at the functions that it allows in their EFTA levels. In some states, they don't allow dental assistants to perform restorative functions, or they don't allow dental assistants to monitor nitrous oxide. So if a state wants to open that up, the model could be used as a framework to make recommendations for change. The model can also be used internally by a dental clinic or a practice to create their own in-house training programs or their own internal career tracks for dental assistants within the parameters of what their state already allows. And I can get into some specifics about that in just a minute. Next slide. So this is a snapshot of what the model looks like. The actual document, which you can download from DANB's website at danb.org/model. It's a fairly lengthy document. There's a lot of really good detail in there. So if you're interested, it's right there and you can download that for free. But the overarching concept of the model is that it starts with the entry level, and that includes training on the basic chairside functions, as well as infection control and dental radiography. And then level 2 is monitoring for nitrous oxide and an intermediate preventive functions assistant. And then level 3 is a restorative EFTA with more advanced functions. So the next slide is, you may be wondering, how does Pennsylvania's dental assisting requirements and scope of practice compare? So this is kind of a side-by-side summary. It looks at things at the high level. And so there's a lot of good news here that Pennsylvania's radiography requirements already align with the model. And Pennsylvania's EFTA level is kind of covering both the preventive functions level in the model and the restorative functions in the model. So Pennsylvania has that all in one level, and the model has it broken out into 2. So there's a lot of commonality already. But the areas where you can see where there's maybe some gaps are in that entry level and then in the monitoring nitrous oxide. So if you go to the next slide, there are some suggestions of what it could look like to build out a little bit more at that entry level, which would allow dental assistants to build that foundation of the critical kind of foundational concepts that they need to know that, first day, first week, first month on the job. Definitely opportunity to set the foundation in infection control and some of the basic chairside assisting, as well as create some progressive career milestones that could lead to the EFTA. And these kind of career tracks can be built out in the clinic, especially in a state, like Pennsylvania. And most states don't have entry-level requirements or infection control requirements. And so when a state is open at that level, that's where the clinic can step in and build out their own internal ladders. Next slide. So this is an example of what some of these internal ladders can look like. And in the fall, I was at the NOAA conference, and I facilitated a panel session on supporting the dental assistant workforce. And some of the panelists were from clinics that had ladder programs. And there was a lot of interest in the room about what those programs look like. And so here's one example, keeping in mind that I know, some of the functions may not be allowed in Pennsylvania, monitoring nitrous, for example. But a ladder like this starts with that basic orientation and training the dental assistant on the essential functions, then having the assistant move on to earn their certificate for radiography. And again, many states don't have infection control requirements, but this could be something for the clinic to build into its training and into its own framework for dental assistants to progress through. There's opportunity for certifications to be some in-house milestones. And then if the assistants at the clinic do go on to become FDAs in the state, we've also seen some clinics really prioritize leadership in infection control. And so some clinics have that dental infection control coordinator or manager. And there are certificates and certifications that could lead to a role like that. So there's a lot of options and a lot of flexibility that a clinic could consider for building out some of the training that it offers. Next slide. So this is an example of a clinic in Arizona that did just that. This clinic grew 4 or 5 years ago. They had one dentist and one dental assistant. And today they have 10 dentists and 17 dental assistants. And the manager that we spoke with shared that she felt that their training program was the way that they were able to build that workforce. And so they created this program before the professional model existed, but they built it very much what the professional model ended up looking like. So their program is 3 levels. They have DA1, DA2, and DA3. And at each level, there are exam and certification requirements to meet, and those map back to their state requirements, so Arizona's requirements for dental assistants. And so today, about 1/3 of their dental assistants are at that DA3 level. And the clinic is supportive of this and really uplifts the dental assistants as they're progressing in their careers. For example, they display the dental assistant's credentials on their name tags. They offer study groups. And at each level that the dental assistant progresses toward, they have additional responsibilities. And then the increased pay to correspond with the additional work that they're doing. Next slide. And so this is a snapshot of Lori, the manager, and Jackie, who is one of the DA3s in the program. And Jackie calls herself the cheerleader for the team. So when new dental assistants come in, she's very supportive of them and coaches them through it and helps them see that these are things that they can achieve. And I think that shows the success with 1/3 of the dental assistants being at that level 3. That their approach has been working really well. Next slide. And so this case study really is backed by the data as well, and what you heard at the very beginning of the presentation, that dental assistants are really eager to have professional development and grow. Every 2 years, we survey dental assistants on their salary and satisfaction. And among the entry-level dental assistants, so those who are, 1 to 3 years into the profession, 40% said that they would like to stay in dental assisting, and 22% were unsure, but that meant they could be convinced. And so this is really where the clinic opportunities can be the difference, whether the dental assistant stays in the profession, whether they stay in the clinic, or whether they move on to something else. Next slide. And so the most convincing things for a dental assistant are those opportunities for career growth and the higher pay that would come with the additional responsibility. And so we see this consistently, that clinics and practices that invest in their dental assistants not only get more out, but they get more back in terms of the dental assistants' loyalty and their abilities to contribute to the clinic. Next slide. So in our survey, we looked at dental assistants who hold the certified dental assistant certification compared to those who don't. And what we see year after year is that dental assistants who are certified do demonstrate that greater loyalty to their employer. They're more likely to stay with their current employer, and they're also more likely to be a leader in the clinic or practice. They're more likely to train other dental assistants, to supervise other dental assistants, or be that lead dental assistant. So again, that certified dental assistant can be that strong player, both because they're staying with the clinic for the long term, but then they're in that position to supervise and coach the other dental assistants. We also see that there are personal and professional rewards for the dental assistant themselves. They often speak to the greater knowledge that they have. Confidence, this is a big one, especially in a fast-paced environment where patients might be going to the dental assistant with their questions. The confidence is a big factor. The higher job satisfaction, and that career growth opportunity. Again, one of the most important things. Next slide. So now I'll shift into talking about expanded function dental assistants a little bit. And we've done some deep research on this, looking across the country. We're on the cusp of publishing it. So you are among the first to see a preview of some of the results. Next slide. And so we know, as you heard earlier in the presentation, EFTAs can really accelerate what a clinic is able to accomplish, both in terms of efficiency and productivity and seeing more patients. But what EFTAs look like across the country is very, very different. There's the EFTA level in Pennsylvania. Other states have an EFTA level, but even what these levels are called are very different. Sometimes it's called a registered dental assistant. It might be called a licensed dental assistant or a DA2 or some other term. So nationally, there's no agreed upon language for dental assistants like this. And there's also no agreed upon scope of practice. In our research, we focused on a select number of preventive and restorative functions, but every state approaches it a little bit differently. Next slide. So one of the things we looked at, and you heard about this a little bit in the beginning, we looked at the states that have a designation for expanded functions and that have a way of counting the number of dental assistants that are at that level. Some states do have an EFTA level, but there's no licensure or registration. So there's really no way to know how many dental assistants are working at that level. So we looked at the states that do keep track, and of those states, what percent of dental assistants are working as an EFTA? And there were some states that had a very low rate. I call this EFTA on paper, where it's out there, it exists, but maybe in the whole state, there's only 30 EFTAs. Pennsylvania comes in pretty strongly at over 20%. So that's good news to have that fairly strong workforce. And there's a lot of factors. It's pretty complicated what goes into whether a state has a lot of EFTAs or only a few EFTAs. Next slide. The other thing we looked at are the tasks. And so this again goes back to some of the things you heard earlier about dental assistants and EFTAs being underutilized or not being delegated to the full scope of their practice. So we asked dentists across the country about, it was about 10 functions and whether they delegate these functions to at least one dental assistant. And so these were the functions that were delegated most frequently. And I put a star by the ones that are allowed in Pennsylvania. Topical fluoride, for example, was very widely delegated by most dentists. It was like 90% of dentists said they delegate this to at least one dental assistant. Placing, fabricating, and cementing temporary crowns was about 84%. Performing coronal polishing, 78%. Placing sealants was around 65%, and monitoring nitrous was around the lowest. It was a little over half. And again, because some states just don't allow this. Next slide. And these were the functions that dentists delegated the least. So all of these were about 30%. Dentists said they delegated, and you can see it's a lot more of those critical restorative functions that dental assistants do. And the reasons why these aren't delegated as often as the other functions, again, it's probably pretty complex. It could be either that the state doesn't allow it. It could be that there just are very few EFTAs in the state and it's hard to hire someone to be able to do this. And then sometimes dentists just prefer to do it themselves, and they might not see the full impact and the full benefit of delegating to the dental assistant's full scope of practice. So there's a lot of complications in this, but one of the things that was encouraging was that when we looked at this by practice type, dentists working in FQHCs were among the most likely to delegate restorative functions compared to dentists in private practices or DSOs. And that's something I've heard in conversations, and it may be true in your clinic and your experience, that FQHCs are really on the forefront of having everyone work to their full scope of practice. Next slide. And EFTAs are eager to work to their full scope of practice. So we surveyed dental assistants, and of those who already held an EFTA credential, more than half said that they would like their dentist to delegate expanded functions to them more often. And of the dental assistants who weren't EFTAs yet, more than half said that they were interested in becoming an EFTA. And no surprise, one of the most important factors to them, whether or not they go on to become an EFTA, was whether they would get a pay raise for reaching this level and then taking on more duties. And pay raise was ranked as number one. More important than the cost or the time to earn this credential was the long-term impact it would have on their earnings in their career. Next slide. So I'll close out here with another case study. This is a clinic in rural Michigan, and Michigan, what they call their EFTA is RDA, Registered Dental Assistant. And so this clinic really embraced the RDAs in order to become more productive. So in Michigan, RDAs can do things like place, condense, and carve amalgam restorations. They can do resin bonded restorations, apply sealants and fluoride. They can take impressions. They can place liners and bases, and they can monitor nitrous oxide. And so in the future, the clinic is looking to have the RDAs place temporary crowns as an additional function that they perform. And so with their efforts to fully utilize RDAs, they're able to operate with one full-time dentist and run 2 to 3 columns. And their clinic manager said that they have seen a 16% increase in their productivity since they made the push to really lean on their RDAs. And they've, again, like the clinic you heard about earlier, have been very supportive of their dental assistants to become RDAs. They pay for the education. There's a state exam that they have to take. They pay for that. And they even help them set aside time at work to study. And a couple examples of how this plays out in the day-to-day. So since the RDAs can monitor nitrous oxide, after the dentist administers it, the dentist can then leave the room, go work on other things, another patient, and then the RDA stays in the room to monitor. Another example that they gave was the dentist was working on a patient who needed a filling, and that filling was more complex than anticipated. The patient needed a pulp cap. And so the doctor was able to delegate some of the steps in that process to the RDA and then come back to perform the filling. And so normally this would have thrown the schedule off, and the patients would have started piling up and everybody would have been running late. But because the RDA could take on some of the steps, they were able to stay on schedule even with this unexpected situation. Next slide. And so this is the clinic, some of the team at the clinic, and the doctor acknowledged that at first there was some apprehension about delegating these additional duties to the RDAs, but ultimately it's been really positive for the clinic. They can see more patients. And as you heard about the increase in productivity, and running 3 columns with one dentist has really convinced everyone. And so they're, sticking with it and really seeing the benefits for their community to be able to treat more patients in the most efficient way. And that takes me to the end, I think. Any questions?
Thank you so much, Hannah and Paulette. That was amazing. Um, just want to open up our chat and our Q&A here. I know I have a lot of thoughts, I have a lot of comments, but I want to open it up to all of our people on the call. If there's anything that they have questions, would like more information on, feel free to raise your hand. We can take you off mute, or if you want to use the Q&A feature, that would be great as well. And while you are all putting that together, I do have a question. I found it very interesting, Hannah, when you spoke about that the FQHCs are more likely than DSOs to delegate tasks to FDAs. And I'm not sure if this was captured in your research or if it's too much of a sneak peek. But is there any reasoning behind, why that trend was occurring?
This is speculation on my part. And so if anyone in the audience can add commentary on this, from your perspective, please do. I think it's the mission of the clinics are to serve the most patients. And it just seems like there's maybe more awareness of the benefits of delegating to FDAs and more commitment to, using all the resources to serve the population. I think sometimes dentists in private practice or DSOs just don't have the training, perhaps, or haven't been shown how it can change the productivity, or sometimes it's functions that they like to do themselves. Or it could be that they don't trust the assistant. Maybe the assistant is that entry level, or maybe they're an FDA, but they haven't, had the practice. It could be a variety of reasons. So again, speculation on my part.
Fair enough. And Paulette, I know you do so much in the realm of dental assisting and after work. And I'm just wondering if you can comment on any of that kind of shared sentiment of the individuals and future professionals or current professionals that you come across regarding, having a actual career ladder to really embrace that growth and pursue the profession in a new way.
I think the biggest thing, Nicole, is getting the word out about careers in dentistry just as a whole, right? And I know you had briefly touched on PCOH's Speakers Bureau, or which I think is great, but the struggle that I have found, even working in private practice as an assistant, and I had military background as an assistant, and moving on to hygiene, but the thing is I feel that even dental professionals, dentists that are overseeing the assistants don't know the scope of practice. So the assistant might not know if they haven't been formally trained. Maybe the EFTA is maybe afraid to speak up in that stance as well. But then you also have the dentist that's like, oh, you can just do that. Like I had worked for a dentist that was like, just take x-rays. And I'm like, I am not certified to do that. Like there is no way. So I think the biggest thing to capture all of it, including workforce, is the educational piece behind all of it to get everybody on board. And that's what the professional model is essentially going to do if we can adopt it in multiple states, which would be amazing.
Great. Love that. And I do see a question in our Q&A, Hannah, for you from Donna Murray. First, thanking us for the information, but specifically asking, when will the information be published and where can she locate it? As well as, is there a wheel to provide a quick look on what dental assisting levels, EFTOscope, and training look like? Is there a one-stop shopping to explore what a particular state's requirement is, or credentials, or SOP?
Yes. So the answer is DANB's website. So the model's on our website. You can go to danb.org/model and download either the visual, the snapshot, or the full model, which is, I think, around 20 pages. And then similarly, if you're looking to get more detail on your state or another state, We have one of our navigation tabs is state requirements. And you can go in there and we have it broken out by the different levels. You can also download right at the top of the state page, it's a chart and it breaks out the levels, the requirements, and the allowable duties at each level. Um, and we have that state by state. We have it in an online book form as well if you want to browse through the whole publication or search for a keyword. So we have a really incredible team that keeps all that updated and together. So, and feel free to reach out. We're happy to answer any kind of custom questions, which we do for people across the country.
Great. And Hannah, I know you included the link in your slide, but in our follow-up information along with the slides and recording, I will make sure that we have a link to the model on DNB's website. That way it'll be easy for everyone to follow through and check out. Um, and the one thing that I really enjoyed was the model currently talks about, micro and macro ways to implement this. So it can happen at the practice level, or there can be changes made at the state level. Um, PCOH, you recognize that we do endorse this model, as a supportive workforce solution. How are other states feeling about it? Is it really well known? Are they embracing it as well?
It's really interesting because we have seen a lot of really strong support. And one of the areas where there's been reservation have been um, among certain dentists, typically in private practice, out of concern of, well, I'll say a lot of states already are pretty close to the model without even knowing it. So, again, it's built on commonality. So most states do have 2 or 3 levels um, already. So it's not that far off from reality. But we are seeing some trends across the country around deregulating the dental assistants and out of the desire to address workforce issues. But one of the things that is a consequence of taking away the career ladder is how does anybody advance to these higher levels if dentists are looking to, we're seeing a lot of conversation around OPAs or around EFTAs, and it's really hard for a dental assistant. If you knock out the bottom part of the ladder, how are they ever going to get to the top? So building that foundation and that long-term view of progression through the career, I think is something that deserves more conversation.
Yes. Well, and I think that's definitely a conversation I'm sure our stakeholders, will be having amongst their peers, as well as, if they want to have that conversation with us. But would you say that PA is in a good spot to move forward with aligning our current model to something like the DNB professional model?
Oh yeah, absolutely. Pennsylvania again is one of those states that's already pretty close. Pennsylvania has the radiography requirements. You have an EFTA level. So we see, and a lot of states, are at that place where they have 2 or 3 levels. So we really see that need for support at the entry level, and it doesn't have to be through state law or requirements. It could be done at the practice level or the clinic level, building out how do you get from it's my first day on the job as a dental assistant up to being able to perform more of those expanded functions. So Pennsylvania is in a really good position already.
Well, that is wonderful news for a Friday. I'm going to take a pause to see if there's anything, anyone have their hand raised or any additional questions in the Q&A. Okay. I am not seeing any. So before we end for the day, I do just want to, as always, reiterate, one of the initiatives that PCOH has. And, we know we need more people entering the pipeline. And one way that we are going to do that is to, just bring that presence to schools. And we need professionals no matter what type of dental provider or where you're at on that spectrum in providing care or being involved. We need speakers for our Speakers Bureau. So if you are interested, please, click the link in the follow-up resources, or there's the QR code there. Our goal is to support being in every school so every kid knows that this is an opportunity and that there is a ladder out there, and a firmer ladder, hopefully, coming as well. Additionally, sharing all of our information. And yes, Donna, I do see you in the Q&A. We will make sure to connect you and Hannah after this. So anything else before we end our Friday? I don't see anything. I hope everyone took something away from today's presentation. I hope you all stay warm and safe through this weekend. And thank you to Hannah. Thank you to Paulette for taking time on a Friday to speak to us about dental assisting in EFTA careers and the professional model. I hope you all have a wonderful day. Thank you.
Thank you so much.